So good morning students. Myself Harani, Assistant Professor in the Department of Agriculture and Engineering. Today's lecture video is about type 2 disorders. So type 2 disorders, in type 2 disorders we are going to discuss about what are all the disease. So first disease is cancer. So cancer is nothing but it can affect different parts of the body and is characterized by rapid creation of abnormal cells in the part. So there is an invade of cell division or abnormal cells in the cell growth, that is called cancer. More than 7 million people die due to cancer each year. 30% of diseases are attributed to lifestyle choices. So cancer is uncontrolled growth of abnormal cells in anywhere in the body. These abnormal cells are termed as cancer cells, malignant cells, or tumor cells. So this is the pictorial image of cancer cells. You can see in the left side there is a normal cell. There is a layer of the tissue. This is the layer of the tissue. In that you can see the normal cells. Here you can see the cancerous cell multiplying and invading. So this is a normal cancerous cell. This is the normal cell. This is the cancerous cell invading abnormal cancerous cell. So these cancer cells and abnormal cells are compose the cancer tissue, where it is further identified the name of the tissue that the abnormal cells originated from. For example, breast cancer, lung cancer, or colorectal cancer, where it is originated. When damaged or unrepaired cells become cancer cells and show uncontrolled division of cells under growth, that is a mass of cells develop. So frequently cancer cells can break down from this origin mass of cells and travel through the blood and lymphocytes and settle in other organs, where they can repeat the uncontrolled growth cycle. So that process is known as metastasis. So here you can see the bone metastasis. Cancer originates somewhere in the body. It can originate in kidney, travel through the blood, and it can grow in bones. This is bone metastasis. The process is called bone metastasis. It is nothing but the cancer can origin in any part of the body. It can travel through blood, and it can grow in any part of the body. That process is called as metastasis. For this process, so these are all the causes of cancer. So anything that may cause normal body cell to develop abnormally potentially cause a cancer. Sometimes it is due to environmental factors or lifestyle factors. Many patients develop cancer due to combination of these both environmental lifestyle factors. So these are all also the risk factors. One is heredity due to chemical substance exposure. So dietary factors like high amount of alcohol, nitrate substances. So due to viruses, stress, and age factors. So how it can be prevented? So changes in our diet and lifestyle, finding precancerous condition earlier. So chemo prevention. So medicines used to treat precancerous condition or to keep cancer from the stage 1, and again then risk reducing cancerous surgeries. Next disorder is diabetes. So diabetic is a metabolic disorder in which there are high levels of sugar in the blood, that is called as hyperglycemia. So under normal condition, food is broken down to glucose, which is then enter into the bloodstreams and act as a fuel to the body. The pancreas produce a hormone called insulin, which helps to carry the glucose from the bloodstream into the muscle fat and liver, where it can used as a where the energy can be used as a fuel. Diabetics are not able to move this sugar out of the bloodstream because of two main reasons. One is pancreas does not respond, produce enough insulin, or their cells does not respond normally to the insulin. That condition is called insulin resistance. So here you can see in the blood vessel the white particles are called normal blood glucose. Here you can see the high amount of white particles, that is high blood glucose, type 1 diabetes. So Type 1 diabetes is also known as juvenile diabetes or insulin dependent diabetes. This diabetes affects both adults and children at any age, where the person's pancreas stop producing insulin and the beta cells or inactivity of insulin producing cells. So these affected individuals depends only on insulin injections daily, based upon daily insulin injections. So this is due to genetic and environmental factors. So some symptoms of type 1 diseases, type 1 diabetes are weight loss, frequent urination, excess thirst and hunger, weakened fatigueness, nausea, vomiting, etc. So this is the risk factors of type 1 diseases, family history, so disease of pancreas or infection in pancreas or illness that affects the pancreas. So next is type 2 diabetes. This is the most common form of diabetes that most occurs in adulthood. However, increased obesity rates, sedentary lifestyle, teen and young age also diagnosed with this type of diabetes, where the fat and muscle reval cells does not respond correctly to the insulin. This is called the process is called the insulin resistant, where the blood sugar cannot enter into these cells for storing the energy and build these insulin build up this blood sugar, these glucose deposited in blood glucose sorry bloodstream. So the symptoms are blurred vision, hard to heal the skin and tingling, and sometimes there is a numbness of hands and feet. These are all the risk factors of type 2 diseases. Sorry, diabetes, obesity, family history of diabetes, history of gestational diabetes, mm, high risk of developing diabetes, old age, and hypertension. So next disorder is ulcers. Ulcer is nothing but a sore that heals slowly and occurs often, reoccurs often. So ulcer can occur any part of internal, both external in the body, from eye to foot. So ulcer is a break or discontinuity in the body membrane that disrupts the normal function of the affected organ. So these are all the common forms of ulcer. Pressure ulcer, it is also known as bed sores. Next is genital ulcer. It occurs in the private areas, genital areas. So next is diabetes foot ulcer, a major complication of diabetic foot. Corneal ulcer, inflammatory that affects the condition occurring in cornea, eyes. Cornea in eyes. Mouth ulcer, a painful sore inside our mouth. Peptic ulcer or stomach ulcer, the sore occurs at the lining of the stomach. Next is venous ulcer, wound that occurs due to poor functioning of the veins. This is the pictorial image of types of ulcers. So this is symptom is peptic ulcer. The most common symptoms is burning stomach, which is due to stomach. Sometimes it can occur some stomach pain, which is due to stomach acid. Taking an acid reducing medication can relieve the pain. Common symptom is upper abdominal pain. Medication can reduce the symptoms.